Hi everybody, my name is Dr Zoe and I'm a GP. Well, I'm actually a portfolio GP, which means I work as a GP, but I do a bunch of other stuff as well. So a lot of the stuff that I do is around our physical health and mental health, a lot of stuff about physical activity, nutrition, but also I co-founded an organisation called Fit for Life, a not-for-profit. And at Fit for Life, we work with young people and what we do is we co-create physical activity programs with them. We tend to work with groups of young people who we feel can benefit the most out of being more active and co-creating physical activity programs. Well, so far we don't actually have a treatment as such for coronavirus. So therefore, most people who get it, especially young people, will get a mild to moderate illness, and actually your body's immune system will go into battle against the virus and your body's immune system will win. And for those people, the illness tends to last about a week, although we know it can take people quite a while to fully recover after that. Now, the people that we hear about going on to have a more complex disease, those people who need to be admitted to hospital and in some cases need intensive care. By this phase, it's not so much the virus itself that's causing the damage, it's the body's immune system has kind of overreacted in some ways to the virus. Now, we don't have a treatment, so when people are in intensive care, essentially their treatment is just providing support for their body's immune system and their body to recover and heal itself. So in intensive care, patients have machinery that can help them breathe. They'll have a tube going into their stomach to feed them. They'll have a catheter draining their bladder. Because when patients are in intensive care, really, they're completely incapacitated. They're not doing anything. They're in a complete, ideally, as getting as much rest as possible to give their body the best possible chance of healing itself. But there is no treatment. There is no cure as of yet for this disease. There are lots of very clever scientists all over the world working flat out to try and find one, but there isn't a treatment as such. I wish I had a really simple answer, but I don't. But there are certain groups of people who tend to be affected more by coronavirus. Age is the biggest indicator of how well or how not so well somebody might end up suffering with the coronavirus. The older people are, the more susceptible they are to getting the complications of coronavirus. Up till now, we've actually seen that children and young people don't tend to get seriously affected really at all. People who are relatively young, say under the age of 60, who don't have any medical issues, again, tend to do fairly well. And it's those that are over the age of 60, especially over the age of 70, and even more so as people get older, they're much more likely to have those complications of coronavirus. And then people with underlying health conditions. So if we know some people have to shield, and those are people who have weakened immune systems, either because of the illness that they have or because of the medicines that they're taking. But also, surprisingly, and we don't really know why, this disease tends to affect men much more than women. We don't really know why that is. There are some theories out there. Also, it really tends to affect people who have obesity, type 2 diabetes, high blood pressure and heart disease. So that sort of collection of diseases that are kind of linked to our lifestyles. We're seeing older people, definitely, men, definitely, but then also if you have those conditions as well, that paints a picture for people to not do as well. But the good news is for young people like you guys, this is an illness that if you get it, you might not even know you have it because it might give you no symptoms at all, or it will give you mild symptoms like a mild flu. Well, the only way to find that out for sure is to have a test. And recently the government have been opening up our ability to get tests. So now we're at a stage where anybody who works as a key worker, or actually even anybody who is going to work and has to leave their home to go to work, they can apply to have a test, as can members of their household. And I think what we're going to see very soon, the government are wanting to test as many people as possible. So if you have symptoms that you think might be coronavirus, or somebody in your household does, so that you know whether or not you all need to isolate, if you go onto the gov.uk website, you can search for whether or not you're able to get a test. If you think you might have had coronavirus, but you didn't have a test at the time, that's like me. I had coronavirus. I haven't had a test, so I don't know for certain, but I'm pretty certain I did. There are some tests that we're still awaiting from the government called antibody tests. And these are tests that don't tell you if you have it, but tell you if you have had it. So it's actually measuring your immune system's response. So if you have the antibodies, that means that your body has been in a fight at some point against coronavirus. So at some point, those tests will become available. We don't know necessarily who for or when, but the government are working hard on getting these tests to be accurate enough that they can start disseminating them. And I'm quite eager to do one of those tests myself. Even though I'm pretty certain I have had COVID, I won't know 100% for sure until I have one of those government approved tests. Well, the answer is yes. Thankfully, I can report positive news, and that positive news is that the measures we've taken, the staying at home, the social distancing, the washing our hands, we're now seeing really good evidence that it is working. The number of people that are being admitted to hospital, the number of people that are sadly dying, those numbers are going down and down now as the weeks pass. Now, it's important for me to remind you but that doesn't mean we can go back out and start socialising again, because we know that our actions today will effectively prevent or increase the risk of people dying 3 weeks from now. So the fact that, I just touched my face then, did you see that? Shouldn't do that, don't do that by the way. The fact that we are now seeing the numbers coming down is evidence that 3 weeks ago, we were all following the social distancing measures. When I say all, I mean most. And now we're seeing the effects of that. So if we were to start going out and socialising again and breaking those rules, and the transmission rates were to increase, we wouldn't know that for 3 weeks. So that's really worrying. And that's why the government have got to be very, very careful. And their decisions to start releasing the measures, when they make those decisions, are really important and really critical. And it's extremely important that we've done so much hard work to get to where we are. It's really important now more than ever that we stick with it, because otherwise the transmission rates are going to go up again and we're going to see a second spike. That means we'll see those death rates starting to climb again, but we won't see that for 3 weeks. So the good news is that it's working. The peak, we're past the peak. We're coming down the slope at the other side, and we're getting over this thing. We are winning the fight against coronavirus. The sensible, not so good news that comes along with that is that the fight is not over. Think of it as 10 rounds of boxing. We're probably about 5 rounds in and we're winning. But if we give up now, the coronavirus could still make a comeback, could still win the fight. So we've got to just stick with it. Well, for me, I would not be able to get through this anxious, worrying, traumatic time without exercise. For me, it's all about exercise. It's what keeps me sane. It's what keeps me well physically, but it's what keeps me well mentally as well. And sometimes, trust me, I really can't be bothered. If I get home, my shifts at work are 12 hours at the moment, and I get home and I really can't be bothered. But I know that if at some point during my day, even if it's just 10 minutes, 20 minutes, whatever I can do, it not only gives me a lift, it helps me concentrate, it gives me clarity, it makes me feel better about myself, and it just helps me deal with the anxiety of everything that's going on. And at the start of all of this, I got into yoga because I was unwell myself with coronavirus. I didn't really have the energy to do my usual sort of regime for a while. So I got into yoga, which was great. I really enjoyed that. But more recently, I've got into Zumba. I love dancing. It's so much fun. The good news on this one is that it's a big fat no. Nobody will have to go without a ventilator. In the UK, we have enough doctors, we have enough nurses, we have enough ventilators, we have enough equipment. Every single person who needs intensive care will receive the best care and the care that they need. And that is, for me, it makes me a little bit emotional saying that, because I think for all of us as healthcare professionals, that was our biggest fear. After having seen other countries where that hasn't been the case, that was the biggest fear that we faced. Now, we built the Nightingale hospitals. In London, we built the Nightingale Hospital at the Excel Centre, 4,000 beds potentially. And the great news is that we're not going to need to use that facility for what it was originally set up for, because the hospitals have managed to cope. They've managed to cope just about, and they've had to make a lot of changes. And the intensive care doctors and nurses, I don't know how they have done it, but they've changed their surgical theatres into intensive care units. They've changed their recovery rooms into intensive care units. They've even turned some of the wards into intensive care units. Thing to bear in mind, they haven't had any extra intensive care doctors or nurses, so lots of additional staff from the other wards have helped, but haven't necessarily got the specific training they have. So I think at the end of this, the heroes of this are going to be, yes, doctors and nurses and key workers, but those who are trained, highly trained and skilled in intensive care, they're the ones that have saved all of these lives. Without them, this wouldn't have been possible. So the Nightingale hospitals will still be used, and I think they'll be used to treat patients with coronavirus to enable the other hospitals to start getting back to normal practice, so that surgical units can open up as surgical units again, and normal wards can open up as normal wards again, because we need to get our healthcare back to normal as soon as possible, because there are people who don't have coronavirus who aren't necessarily receiving the best treatment at the moment. But every single person, if you have family members, everyone who needs intensive care support will get it. And those that should get a ventilator will get a ventilator. So, big sigh of relief on that one. Well, that's it from me just for now, guys. Thank you so much for listening. Do follow us at Fit for Life CIC on Instagram or on TikTok. And do stay active. Please stay active during this time. One of the best things you can do for your body, but also for your mind. Take it easy, and we will get back to normal. I promise things will get back to normal. Maybe not soon, but at some point in the not too distant future. So hang in there, people.